tweet today. He said some of the fake news are saying that it is the governor's decision to open up the states, not that of the President of the United States and the federal government. Let it be fully understood that this is incorrect. It is the decision of the President, and for many good reasons. With that being said, the administration and I are working closely with the governors, and this will continue. A decision by me in conjunction with the governors and input from others will be made shortly. Are you aware of that tweet? And I just wanted to get your reaction to it.
I was not aware of the tweet. I've been on phone calls most of the day, as I am most every day lately. I was with all of the governors across the country on a call with Mike Pence earlier this morning, where we were talking about a lot of the additional needs that we have to have in place before anyone can really start focusing on opening up. And so the government doesn't get opened up via Twitter. It gets opened up at the state level, and I'm working with my colleagues across the country to make sure that we're thoughtful, that we are also thinking regionally. I've been in contact with a lot of my fellow Midwestern governors on this subject specifically, because we recognize that we've got to have good data, we've got to have a good plan, we've got to make sure that we avoid a second wave at all costs. That would be devastating for our economy. And so we're going to make decisions based on science and having a real strategic phase-in of our economy when it's appropriate and safe to do so.
Governor, late last month, Lee Chatfield tweeted about trusting you to do the right thing, but in the past week, he's been more outspoken about disagreeing with your decisions. How do you respond to these negative changes in the legislature's reactions?
You know what, I'm not going to. I'm going to just say this. Every decision that we're making is based on the best science, the facts that we are confronting as a state. I will say that I understand the frustration that people have. I'm frustrated too. This is hard. This was not what any of us signed up for, frankly. But the fact of the matter is this is a virus that is ravaging our state, that threatens the very ability of us to meet people's critical health care needs by overrunning our hospitals. We don't have enough PPE. I'm glad you've got a mask. That's great. But we don't have enough PPE for all of our, frontline healthcare professionals. And we have COVID-19. There was one map. It was a little hard to see, but it's on the New York Times website if you want to check it out. But it shows, precisely that where COVID-19 already is present across our state. We can be carrying it for days without even knowing it. One person touching, I keep focusing on the gas station, on the pump, but COVID-19 can remain active for 72 hours on a piece of stainless steel. You think about how many people have touched that pump over the course of 3 days and not even knowing if they're carrying COVID-19. And some of those people are nurses and doctors and police and fire and grocery store workers. And we want to make sure that they are able to do their jobs, and the more people that are out and about, the more in danger we're putting their lives. And that's precisely why we've got to continue to follow the science, be smart about the decisions we're making, be clear about why we're making them, and ask Michiganders to keep doing the right thing. By far and large, people are doing the right thing, and that's precisely why we're starting to see this curve look a little flatter.
Governor,